Welcome to the Dr. Hotze Report at the intersection of medicine and politics. Your host is Dr. Stephen Hotze, founder and CEO of Hotze Health and Wellness Center in Houston, Texas. Dr. Hotze is a graduate of the University of Texas Medical School in Houston and has overseen the treatment of 45,000 patients. He has been a leader in the wellness revolution since 1989. Dr. Hotze has hosted over 1,400 of his own radio programs and appeared on hundreds of other radio and TV programs across America. He's a renowned author, speaker, and conservative Christian patriot leader. Now, here's Dr. Hotze and the Dr. Hotze Report.
Hello, I'm Dr. Steve Hotze. We have a dynamite program today. If you've been concerned about your health, and if you know someone, either yourself or a loved one, family member, friend, who has been diagnosed with cancer, or has cancer, you're going to want to stay tuned and get them this program. I'm going to have as my guest today, Dr. Nathan Goodyear, who's the medical director of the Brio-Medical Center in Scottsdale, Arizona, which is a suburb of Phoenix, kind of like Katy is of Houston. And it's a beautiful area out here, but we're going to talk about alternative, innovative, integrative, reparative, restorative, natural approaches to treating cancer without poisoning the body and killing the body. You know, in my philosophy has always been in the conventional treatment of cancer, the treatment's often worse than the disease. And we're going to talk with Dr. Goodyear about that and let him explain to us why he has chosen to do an innovative, integrative, natural approach to treating cancer. We'll be back right after this message. Welcome back to the Dr. Hotze Report. Today, we're going to be talking about cancer. And we're going to be talking about the conventional treatment of cancer, which is cytotoxic chemotherapeutic drugs, radiation, and surgery. And we're going to ask the question of Dr. Nathan Goodyear, who is the medical director at the Brio-Medical Center here in Scottsdale, Arizona. And their primary focus is the treatment of all types of cancer. And Dr. Goodyear went to medical school at LSU, and then then went on and did a obstetrics and gynecology residency in Tennessee and practiced OB-GYN for a number of years, but got interested in natural approaches to health. And because of a personal health problem, he became interested in cancer, and one thing led to another, and he became a director of Brio-Medical Center, and he's been practicing alternative medicine for at least 15 years, and over the last 6 years, strictly natural approaches, holistic approaches, integrative approaches to the treatment of cancer. So Dr. Goodyear, welcome to the program. I just want to congratulate you on your success here at the Brio-Medical Center and in your career. It's very few doctors we see have the courage to leave conventional medicine and really embark on a track that most doctors aren't willing to do, and that's to question the status quo and see, is there any better way to treat a problem than the current medical protocols? And you've done this in your evaluation and your treatment of individuals that have cancer and with the natural and holistic approaches to cancer. So welcome to the program, and thank you for joining us today.
Well, thank you, Dr. Hotze. It sure is an honor to be on your program. And I would tell you this, being a physician is not serving a system, it's serving a patient. And one of the great aspects I think that medicine has forgot is that what medicine is about is it's about asking questions. It's about the science of curiosity. And when we lose the ability to ask questions, or when we lose the ability to think that we need to ask questions, or when we lose the ability to think that we need to strive to do things better, then what we're going to be doing is hurting or holding back potential innovative therapies for patients with cancer. So it's truly an honor to be with you, Dr. Hotze.
Well, listen, I first met Dr. Goodyear at a conference about a year ago in Fort Worth for the frontline critical care COVID doctors, and he spoke on his approach to cancer, and he was out in Scottsdale. I came out recently for another FLCC conference, met with Dr. Goodyear, have a guest that happens to be a patient at Dr. Goodyear's center here. And so I've gone through the center and I've looked and evaluated everything they do, and I've been so impressed with the various different modalities, the equipment, the IVs, the medications that they use to help ultimately treat cancer and cure cancer is the goal. The goal is for a person to be cured. And I know we've had individuals of ours go in Houston to a very famous medical center there and been told, well, we can't cure you. You know, what's your 5-year survival rate? Well, basically 0. So the patient said to the doctor, you mean I'm going to come here with a guarantee within 5 years I'm going to be dead, and I'm going to let you poison my body? And this individual said, I don't think that's the route I want to go. And she asked me about that. And I said, well, we know there's other alternative approaches to cancer. And I know that Dr. Goodyear is a Christian man, a godly guy. He's got a great center, and I'd recommend you going out to see him. And she did. And I happened to be out here in Phoenix at this conference. And so I came by and saw the clinic too. And I just want to tell you, you've got a wonderful center here, wonderful people. They're kind, sweet. So tell us, in the conventional realm, they use chemotherapy, they use radiation, and they use surgery. And we know what the results are. They're horrible. I see the results of all of the people. Their hair falls out, you know, they lose weight, they're sick. I mean, their mouths break out, they can't eat. It's horrible. And I go like, that's the best we can do for cancer. So, and I know that I can't tell you the number of people I have known that have died undergoing that conventional treatment. They've died from the chemotherapy or the radiation or the complications thereof. And the doctor said, well, they didn't die, at least they didn't die of cancer. It's crazy. So tell us about this idea of this unholy trinity. Tell me about it. Why it's from a 36,000 view, what's wrong with the picture?
Well, I think what's wrong with it is, and I came up with that title because, you know, as a believer, as a faith-based person, you know, I feel that, you know, life and healing is through the Trinity, right? That's through Jesus, and that's why I say hope, heal, teach, serve, legacy. Those are the principles that guide me as medical director, that guide this clinic. And so if you look at the standard of healing potential as being the Trinity and look at surgery, chemo, and radiation, what you're seeing in those three strategies is that the pathway forward, or this is the proposal, the pathway forward to healing is through destruction. That's the way they present. We're going to destroy your body. Chemotherapy does one thing, and it does it very well in a high dose. It destroys. It destroys everything that's growing. Radiation causes cancer. Radiation destroys cancer. Radiation causes new cancer. Radiation spreads it. Of course, surgery is in and of itself destructive. So for me, I thought it was really good to coin the phrase unholy trinity because it is counter to what healing is. And healing is something that's not just passive, it's active. And so for me, it seemed a good contrast to provide it in that light because it is a contrast to the healing. For example, when Jesus walked this earth, you know, he didn't destroy to heal. He healed. That's right. He healed to heal. He didn't destroy to heal. It would be like this, Dr. Hotze. It would be like if I was you were a financial advisor and somebody was saying, well, Dr. Hotze, advise me on how to make $1 million. You would say, well, let me tell you what you're going to do. You're going to go bankrupt 3 times. And if I was smart, I'd go, Dr. Hotze, you don't know anything you're talking about. Because that means you have to repeatedly fail you have to destroy to then reach healing. And it just doesn't make sense to me. And in fact, when you look at the science, what we know about surgery, what we know about chemo, what we know about radiation, especially when you look at chemo high dose, These three set the stage for cancer to spread. The
Well, I
evidence
thought
is
this
very
was-
clear.
listen, I saw a podcast that you did on this unholy trinity, and I thought it was so well documented, and you made very clear points about what is the downfall of chemotherapy? What does it do? How does it increase your risk of having metastatic cancer? What does it do? Why would it cause that? We know it can kill. We know that if you give enough of it, you can kill the whole person. The cancer's dead. Everybody's dead. But
That's right.
Can you give enough of that it doesn't affect any of the other cells? And how does it increase metastatic cancer? And I noticed you had a lot of, and you don't have to give us the paper and the numbers and all that, but I know you cited a number of papers that explained why chemotherapy doesn't work.
Well, I would say if they want to
in the
get,
vast majority of cases.
yeah, if they want to get into the specific details and actually read the studies, which I encourage because that's an empowerment of knowledge, is you can
Right.
check out the podcast, Practicing with Dr. Nathan Goodyear podcast, and it's all listed there.
Okay,
But
it's Dr. Nathan Goodyear podcast.
Yeah, Practicing
on
with
there.
Dr. Nathan Goodyear. Yep. And you can find that at drgoodyear.com. So if you don't download from Apple any of those sites, you can find it at drgoodyear.com. But full dose chemotherapy does a lot of different things that can actually propel the metastatic spread. One thing I think in general that is a hallmark of all those different methods is what it does to the immune system. The immune system is the God-created defense mechanism to protect the body against all invaders, foreign and domestic. And so cancer falls into that domestic category. And so what full dose chemo does is it destroys the immune system. I mean, it's not like anybody can look at the evidence and say there's no evidence for that. No, there is. That's where they came up with a strategy for dosing every 3 to 4 weeks. They had to give the immune system a chance to recover. But what happens is when your immune system is knocked down, particularly, we know this, very particular types of immune cells, CD8 cells, cytotoxic T cells, natural killer cells. These cells, when they're knocked down, these lymphocytes, then the immune system cannot activate towards the cancer. So if any cancer is left, then what's going to happen is they are going to mutate because of the forced pressure of the full dose chemo, but the damaged immune system is going to allow that to propagate. And so what you're doing is you're setting the stage. You may achieve no evidence of disease, and that's wonderful. Nothing wrong with that. In fact, they've shown in breast cancer research, you shrink the primary tumor, but you spread it. So if we've taken, say, a stage 1, stage 2 cancer, and then we damage the immune system and we set the stage for it to spread, and now it's stage 4, now we've got a problem that conventional medicine and science as a whole says we can't do much about. We can't, as you use the word, cure. But here's the interesting strategy. When you lower the dose of the chemo, low dose metronomic chemo, what then happens, and we're talking about a very small dose, 5, 10%, maybe 15. Now it doesn't become immunodestructive, it becomes immunomodulatory. You can actually stimulate those same cells that full dose will destroy. You now stimulate those cells. Over and over again, the research has shown that cisplatin, doxorubicin at high dose, these will specifically damage the immune system and trigger the inflammatory response and how cancer will spread. If you lower the dose, now you can actually stimulate the immune system. But here's the great thing is you actually broaden the anti-cancer effect. It becomes anti-angiogenic. It still is directly cytotoxic. So now you're taking something, not destroying the body, but actually targeting the mechanisms that are driving the cancer and leaving in place the immune system to do its job.
And that's key. So you mentioned that not only in the current state of cancer chemotherapy, then we'll give full dose cytotoxic drugs for any cancer, whatever the particular drug for a specific cancer, that it has been proven to increase metastatic tumors. It increases the blood supply, the angiogenesis, new blood vessels grow. It causes local recurrence, chemo, and they become chemo resistant, as you mentioned, and it depresses the immune system. So let me just ask you this. Statistically, you take all cancers, somebody goes to Mayo's or MD Anderson, and they're going to get treated for that. Statistically, what percent of people, and of course it's all depending upon the stage of the cancer, I'm sure, but in general, what percent of the people will live 5 years after a diagnosis of cancer if they undergo conventional chemotherapy and radiation and surgery?
Well, I'm gonna quote you a study here from actually 2000. It was actually published in 2003, August of 2003. The title of the article, Dr. Hotze, was called "The Contribution of Cytotoxic Chemotherapy to 5-Year Survival in Adult Malignancies," and they looked at 13 different cancer types in this study, and they actually looked at it in Australia and in the U.S. and that they found that in breast cancer, in cancer overall, there was only a 2.1% improvement in 5-year survival by full dose chemo. 2.1%. So we're talking about negligible to nothing.
Yeah.
But then they didn't even comment, Dr. Hotze, on the side effects, the sequelae. You know, how many of these people had serious adverse events? How many of these people succumbed to the side effects? None of that was addressed. It was just an improvement in 5-year survival. 2.1%. The entire strategy of full dose chemotherapy is built on 2.1%. Now, of that, how much of that stage is now set for the spread? For it to go to bone, to go to liver, to go to lung, to go to brain. And that's the whole issue. We can do better. For patients' sake, we must do better.
Right. Okay. Radiation. Similar problems. Tell us how radiation harms and has, and statistically, based upon studies, has been shown to spread cancer, increase the risk of local reoccurrence of local cancer, and damaging the immune system.
Yeah, you know, radiation is really interesting because it's a paradox within a paradox within a paradox within a paradox, because radiation causes cancer. I mean, see Chernobyl. Right. Radiation is used to treat cancer. And then radiation causes metastasis. And then it causes local recurrence. So it's really an interesting paradox here with radiation. And people go, well, I don't believe in the low-dose chemo approach. It's like, well, isn't it interesting that now in the radiology oncology approach to cancer, they're using low-dose and targeted radiation. So basically what you're doing in the low-dose chemo dose, where we're talking about 5-10%, we're following what they're doing in radiation. They're not radiating whole brains. So just some mechanisms. Radiation increases circulating tumor cells. It suppresses the immune system. It actually damages the bed of the tumor and sets the stage for local cells to actually recur. And then it actually has been shown to activate dormant metastatic sites in distant areas. So these aren't just, you know, this isn't just anecdotal evidence. This is the science that's bearing out the what, but the how, the mechanisms. That's a crazy thing. It's the mechanisms are now known.
Well, so we know both of them have significant and adverse side effects. It promotes the spread of cancer and metastatic cancer. And obviously surgery, give us that. But I mean, it's obvious, you know, to me. Tell us about surgery. And well, tell us about the adverse effect and what that causes.
Well, you look at Dr. Benjamin Rush, who was, you know, the surgeon for one of our presidents, and he said, rush to the knife. First, always rush to the knife. That was kind of just a paraphrase, but let me say not necessarily surgery, because surgery will increase circulating tumor cells. But here, there's actually an article published just in 2023, and it was entitled "Needle Biopsy Accelerates Pro-Metastatic Changes and Systemic Dissemination in Breast Cancer, Implications for Mortality by Surgery Delay." Now, they talk about surgery delay, but the take home from this article is that the biopsy, we're not talking surgery, We're talking about a core biopsy changes the immune system within the tumor microenvironment, particularly what's called macrophage polarization, and it's causing these immune cells to become activated against the immune system and allowing the cancer to grow. A biopsy. So, so it's not just surgical resection. Because I was a surgeon, that's mostly what I did as a pelvic floor surgeon. And when you look at the vaginal mesh, Dr. Hotze, a little bit aside, they were actually shown, you probably remember all those cases as it relates to the thousands of women that were harmed from those surgeries. But they actually showed that once you remove that vaginal mesh from those women that have pelvic floor surgery for prolapse, the inflammatory reaction remained. So you can go on and biopsy, and you're going to not only increase circulating tumor cells, but you're going to change the immune system. And both of those together are going to set the stages for cancer to evade the immune system, which is a key rate-limiting step in how cancer spread. It evades the immune system. When it does that, then it's time. It's only a matter of time before that will show up in the right circumstances.
Right. So I've always told individuals when they have when their prostatic antigens elevated, PSA, and they go to see a urologist, I'll say, don't let him do a biopsy on you until you get an MRI. Let's see if you really have anything going on down there, because it's like kicking an ant bed. You put a biopsy into a nodule that's cancerous in the prostate, it's going to spread. It's going to disseminate that. That's the same thing that happens in surgery. Now, in some cases, just to get the tumor off another organ so the organ functions, you got to do a resection. I can understand that. But,
and I'm not anti-surgery, Dr. Hotze.
Right.
I'm saying there's the right place and the right time. I'm not anti-biopsy. I hope one day we are going to achieve a situation where we don't need actual biopsies. We're not there yet, but we need to recognize just because we can, doesn't mean we should every time.
That's right. So we know that surgery, radiation, and cytotoxic chemotherapy, that's cytotoxic means it's toxic to the cells, and it's not only toxic to the cancer cells, but to cells over the whole body. All these have been proven to cause metastatic disease. Is that right?
No, definitively.
So that's what we need. So we need an alternative. Now, we're finishing up the first half of the program, so I wanted you to hear the bad news. And the bad news is that this is not working. The conventional paradigm of cytotoxic drugs that poison the body, radiation, and surgery haven't worked. What are the alternatives that we now have in integrative and innovative medical centers where they do regenerative, restorative, natural approaches to treatment? What are these treatments? And we're going to talk about that with Dr. Goodyear when we come back, and you're going to find it's fascinating. There's not just one or two. They are scores, 20 or 30 different modalities and treatments that Dr. Goodyear and his team of professionals provide here at the Brio-Medical Center. So we'll be back with you in just a minute. Welcome back to the Dr. Hotze Report. I have Dr. Nathan Goodyear, Medical Director of Brio-Medical Center in Scottsdale, Arizona, beautiful area of the country. And it's really amazing. I hadn't been out here in this area of the country in, since I was a teenager. And had been up to Flagstaff, and that had to be 50, 60 years ago. So I've come out to this area to go to a conference and come to the Brio-Medical Center. And Dr. Goodyear is one of the leading experts and leading practitioners in doing natural approaches in the treatment of cancer. We talked about on the earlier first half of the program that conventional therapy, if you go to Mayo's or MD Anderson or any one of the Sloan Kettering or anyone around the country, Cleveland Clinic, wherever, they're going to give you cytotoxic drugs that are not only going to potentially kill or hopefully kill cancer cells, but it's going to kill other cells in your body and can make you deathly sick, destroy your immune system. Second thing, they'll radiate you, they'll burn you. and that causes problems as well, to damage to normal tissue, and even the recurrence of cancer. I mean, radiation, can be cancer producing. And thirdly, surgery can disseminate cancer. All these conventional methods have been proven to cause the spreading of cancer cells in your body, which will land somewhere in your body and give you metastatic disease. That means it's spread from the primary source to other parts of your body, and you go from stage 1 cancer to stage 4 cancer, and the doctors say, well, we did everything we could. You better go home and pack your bags and get everything in order. You got 3 months to live, 3 weeks to live. Now, I want to preface this by saying, as a Christian, and I know Dr. Goodyear is a Christian. I know his work. I know where he attends church, and I've seen him pray with a patient. I mean, he's a godly guy. He knows that God is in charge, and he's the sovereign ruler of everything. And he operates under God's authority, being used by God to help people get their health back. Just like if you were a Christian and a yard man, you'd mow the yard to help the people get a pretty yard. Well, he wants to help people get a pretty body in health. So he believes in the principle that he's a teacher and a healer. Now, I want to tell you a story about Dodie Osteen. Most of you all know Joe Osteen, especially in the greater Houston area. People around the country and world know him. Joel Osteen's mother, Dodie Osteen, was married to John Osteen, who started the Lakewood Church. And what happened in their lives when their little child, first little girl was born, she was born with cerebral palsy and brain damage. And she was just a vegetable, basically. It was pathetic. They brought her home from the hospital. He was a Baptist preacher, and they began to read the 4 Gospels and said, "What did God say about healing?" Because they didn't really promote it where he was ministering. And they read about God's healing power, and they laid hands and prayed for that little girl, and she was cured. And she is now married and has kids. Well, he started to promote that at his church. They didn't really like that, so he set up his own church, Lakewood Church. The rest is history. His wife later, when she's about 41 or 2 years of age, Dodie, got terribly sick, goes to the hospital, is diagnosed with stage 4 liver cancer. And they sent her home and gave her 3 weeks to live. I have friends that went to church at that time, and they said it was hard to understand they're in a church that promotes healing, and the wife is dying. She weighs 87 pounds. But she took the Bible and took all the healing verses, put them up on the wall, wrote them down, and read them every day. And I'll tell you what, Dodie Osteen is alive and well today at 92 years of age. I saw her a year ago at a funeral. It wasn't hers. And she was helping a friend at a funeral. She was lovely and bright and alert. And she did it all when she put her faith in God. So first and foremost, if you're sick, I don't care if you got heart disease, cancer, strokes, first and foremost, you need to put your faith in God. God intends for you to be healthy and well. And I know we're all going to die, but God did not mean for us to be diseased and afflicted with diseases. Just go to the Bible. And if you want to, you can, I'll put these on my website. I've got about 150 verses on healing. So I want you all to think about that. Now, the thing I really am impressed about Dr. Goodyear, he starts with the principle that he serves God in his ministry. He has a ministry of healing, and he serves the living God in doing that and serves the Lord Jesus. So, and this has given him insight into alternative approaches to health that don't wage war on the body, but help the body heal itself. So tell us about your different methods, what you all offer here at Brio.
Well, yeah, real quick, Dr. Hotze, is that, if the Lord can raise from dead somebody that was 4 days dead, Lazarus, he's got this, and he has not changed.
Right.
Maybe what has changed is us and our perspective, but he has not changed. And so in that confidence, we know that the healing is there.
Right.
Now, I think when we destroy the body, that's where we set the stage for healing not to occur in the long term. And so when we approach therapies, there's many different aspects that we can bring to the table. Now, here's a great thing. We can follow the science in doing that. The last 100 years has been what's called, one size fits all approach, which is basically, treating the 6'6", 300-pound individual the same as a 5'2", 120-pound. Intuitively, they know they're different. They may have the same cancer type, but they may know they're different. But now we're headed into a paradigm shift, what's called precision medicine, individualized medicine, which is the right treatment for the right patient at the right time. And so when we bring in nutrition, it could be a ketogenic diet, it could be plant-based, it's going to be guided by this information. What I call, it's called the multi-omics: genomics, epigenomics, transcriptomics, proteomics, immunomodulomics, hormonomics, microbiomics, and I also say whatever omics, but we will bring this to the table to guide us on the therapy. Beyond that, we can use supplements. Melatonin is a big one that we will employ there to help. IV therapies, of course, there are many, and you wanted me to give you just a few that we can use. And what I would say is, as I mentioned, where we need some kind of directly attacking therapy that then allows us to also heal the immune system, low-dose metronomic chemo is one. High-dose vitamin C, big fan of it. I've spoken about it across the country. Artesunate, another antiparasitic, not ivermectin. Artesunate's a IV form of an antiparasitic. Interestingly enough, artesunate, the team that discovered that, and ivermectin, those two teams won Nobel Prize of Medicine and Physiology in the same year, 2015. Wow. Big fan of the combination of vitamin C, artesunate, curcumin, quercetin, boswellia, all IV, all safe. Mistletoe, IV. DCA, IV. Alpha-lipoic acid, IV. But there are many, many other therapies that we can use and employ to target what the cancer is expressing so that we can then in turn target the body and heal. And in fact, I would say this, Dr. Hotze, there's a very interesting thing you see with natural therapies. You see it with hyperthermia. You see it with hyperbaric. You see it with vitamin C. You see it with curcumin, and you even see it with photodynamic therapy, which is using light and a photosensitizer. There's what I call a trinity effect, where these natural therapies, these integrative therapies have a propensity to target the abnormal cells only. But beyond that, they don't affect the healthy cells or even promote the improved functioning of those healthy cells. So I almost see Christ in work in the effect of these natural therapies. He created these. And right. So they in turn target these abnormal cells, but not the body. Now contrast that with conventional therapies. They are going to war on the body. And when you go to war on the body, or when you go to war on anything, you turn everything in to the battlefield. And that's right. And so there's collateral damage everywhere. There's death everywhere. Death and destruction is everywhere. So for me, it's something that we employ beyond just the IV therapies, hyperbaric oxygen. I mentioned hyperthermia. Beyond that, repurposed drugs, which is getting a lot of hot topics these days. So these are the strategies that we bring, but we guide them. We precisely target them based on this newer technology of testing that we have available to us.
When we're talking about cancer and people wanting to be healed from cancer, obviously, and I came out earlier and talked about Dodie Osteen. Now, she simply relied on God and Scripture, and God literally healed her, which is wonderful. But a lot of people are unhealthy, and God just doesn't wave a magic wand. Say, for instance, you got cancer and you weigh 300 pounds. Or let's say you got heart disease and you weigh 350 pounds, you got a stroke. Well, God heal me. And you know what he's liable to say to you? Well, I tell you what, young man or sir, what you need to do is get yourself on a good eating program, get down to an ideal body weight, start exercising, cut the ice cream out 3 times a day, and start eating right and being healthy. And quit drinking all the Coca-Colas and drinking all eating out of the bags and foods. We have to take a responsibility for our health. So I know God heals, but God oftentimes uses physicians that have natural approaches to health to give you the proper ingredients or the produce or the nutrients that your body needs that it's not getting. And that's what they do at Brio-Medical Center. They provide you with the expertise to be able to decide whatever kind of cancer you have, whether it's a brain tumor, whether you've got ocular cancer, whether you've got stomach cancer, pancreatic cancer, bone cancer, whatever you have, there are different ways to approach it. And they don't just have one standard method. And they biopsy this, and they send it off, and they do immunotherapy and directed drug treatment on certain, depending on one of the cells, when they do the genetics on the cells. It's very integrated. I've never heard of this being done anywhere else. I'm sure there are other centers that do it, but in conventional medicine, when I trained over at MD Anderson, we didn't do any of that. Basically, you had a protocol. You came in with testicular cancer, it was 1, 2, 3, boom, that's it. And,
well, I mean, we know that hormone receptors. So, for example, everybody looks at estrogen receptors and they think breast cancer, they think testosterone, they think prostate cancer. We now know that where we're moving in this precision medicine area, Dr. Hotze, is that really no longer can we simply look at the histological type of cancer, that is breast cancer, and assume that they're all going to be the same, homogeneous. They're
right.
Very heterogeneous. And so what that means is we actually have to look at how the cancer is behaving, what it's doing. So we can't just look at breast cancer. We have to say, okay, what is this cancer type that's originating from breast? What's it expressing? How's it behaving? We target that. So we can actually maybe use something that would be, quote unquote, a standard of care for colorectal cancer. But because the breast cancer is expressing that, guess what? We're going to target what the cancer is showing us. And that is that arena of multiomics. That is that precision therapy. That is the best treatment for the right patient at the right time.
Now, let me mention for you individuals that are interested in alternative approaches to the treatment of cancer, I highly recommend, this is where I would send my wife to this center. This is where I would come. I've evaluated, I know it. I'm so very impressed with their overall treatment. It's a tripod. It's mental, physical, and spiritual. On the walls, you'll see discreetly there are scripture verses on the walls. There'll be some, and that sets a tone in this. Really, the head of the organization, Nathan's, it all comes from the top down, and he's got a godly attitude, and he loves Christ, and he wants to serve people and help them get well. And that comes right down, and it comes through his staff, and they have that same genuine Christian spirit about serving and helping people get on that path of health and wellness and get their cancer cured. And there are no guarantees in life. You could come here, you could go in for heart surgery with the best heart surgeon in the world and die on the table. That's happened. Or you can go in and you could have a great heart surgery and survive and live a long, full life. It's the same thing with any treatment. There are no guarantees in medicine. There's no guarantees. Nobody guarantees anything at my office at the Hotze Health Wellness Center. But we know if you'll listen to us and get on this plan and work it out, we know from our past experience that it's going to give you significant improvement and dramatically increase your opportunity to live a long, successful life. Let's talk about, and they do this, and you can go to Brio. That's BRIO, B as in bread, RIO, med-med.com, or it's -medical.com.
Yeah, Brio, you can find us two places really, Brio-Medical.com, or then you can find the personal brand website at drgoodyear.com. And then the podcasts are where we dive deep in, and you'll find that on drgoodyear.com. We also have regular webinars. We're very active on all things social media because, as you mentioned, Dossier Rofik, teachers that heal. That's what that means. So we want to heal. And so when you're talking about Jesus, you're absolutely right. Why would we exclude the source of healing from the process of healing?
Right.
That's ridiculous. So that's the reason for the scriptures. We want to invite in the actual origin of healing, but we're also teachers. That's what the word doctor in Latin can mean, dossier. So we have to teach people how to heal. So we're active in getting that information out there to empower individuals to know that there is a way that they can heal, and there's a way that can actually work with their body, not against it. But hopefully also teach doctors. if it's one thing to be able to take care of 30 people that have cancer and heal them, what if we were able to teach 30 doctors? Now
Right.
It becomes something exponential.
And you're a wonderful teacher too, so I'll give you credit on that. And that's when I first heard you speak, and that's when I said, I just made the judgment. I make quick judgment. This guy knows what he's doing, knows what he's talking about. And then when I met you, you had that genuine. I knew you were a Christian just by talking to you. I don't know why. I guess the Spirit of God.
Sure.
You just know those things. By a person's spirit, you can reach them. Well, let's talk real quickly about I was trying to hold it off. Let me tell you, folks, in truth, why I'm here. My wife has cancer, pancreatic cancer. And of all the places in the country I could bring her, I brought her here to Brio-Medical. And it's been a godsend. It's been wonderful. So I didn't know if I wanted to, it's known around town. People know we're praying for her. So her name's Janie. We've been married 54 years. I would covet your prayers. Okay. I love her. I've loved her. We have 8 kids and 25 grandkids. So, but what we're doing, folks, is we've got about 125 verses of scripture. We read half of them in the morning, half of them in the evening, pray together with our family. All our kids are coming up. And we are trusting God and praying for Dr. Goodyear and the other members of his staff to provide the proper things that provide healing for Janie. We believe God's healed her. We're claiming that as a promise. So anyway, I'm sorry I got off track there, Nathan. But our Dr. Goodyear, I just feel like I needed to say that. God pushed me to do that. Okay, tell us about the repurposed drugs quickly. How about you've heard the talk of fenbendazole and Joe Tippins and this guy that had stage 4 lung cancer and gave 3 months to live, and his veterinarian friend had stage 4 brain cancer and had taken a drug for animals, fenbendazole, which is an anti-parasitic drug, and she cured her brain cancer in stage 4 and gave it to him and said, "What do you have to lose?" And he said, "Nothing." And he took it, and 3 months later, he was cleared. Now, you can call it anecdotal. It's about as anecdotal as when Jesus said, you can't see, but now you can see. Open your eyes, you can see. And the guy said, "I can see." And he said, goes in and he tells the Pharisees, "Look, I can see again." And they said, "Well, how in the world did you get it?" "Well, Jesus healed me." He said, "Does he do it by Satan?" He goes, "Guys, you're the experts around here. I don't know. All I know is I was blind and I can see." You figure out how that happens. And that's the same thing that we talk about with God. With healing, God can do a healing, and we don't know exactly how it's going to come about. But when they used this fenbendazole, they got healed in three months. They were gone, and the guy's alive 6 years later. You got to say there's something to it. It's an anecdote to doctors that want a double-blind study. What do you give us a quick synopsis on ivermectin, which was used during the COVID, and also mebendazole, which is a unit anti-parasitic drug?
Yeah, mebendazole, but there's even albendazole, but albendazole is a little bit more expensive. These are human-approved therapies for antiparasitic, but they have broad anti-cancer activities. Most of that being preclinical, but understand that these are not new to the arena of cancer therapy. So we don't use fenbendazole because we don't need to. We use mebendazole. The therapy shows us how to. So these research studies show us how to actually dose it. And then, of course, ivermectin. Ivermectin is, at the FLCCC conference, Dr. Pierre Corey and Dr. Paul Merrick and I, as well as Dr. Kathleen Ruddy, announced the first multi-center observational study on ivermectin in cancer. I've been using ivermectin in cancer since 2018. Nothing new. So, we're not dealing with new strategies. And in fact, when you look at repurposed medications as a whole in cancer therapy, this is going back to the early 2000s. Metformin, low-dose naltrexone, celecoxib, even statins, aspirin, dipyridamole, all of these are drugs that were approved for one thing, and now research is showing they can be used against cancer. And again, if you want to do deeper dives, check out the podcast, because there I bring in Paul Merrick's, I bring in Jane McClellan. We go deep on these repurposed medications to dive into the mechanisms, not just the what, but the how.
And you're not going to hear about these from your conventional doctors because the cost is so inexpensive compared to chemotherapy. Chemotherapy costs tens of thousands of dollars, sometimes per dose. And chemotherapists, how they make their money is they buy the chemotherapy and they buy it and resell it to the patient, and then they get paid by the patient, by the insurance company. The only doctors in the country that can resell drugs. So that's why they have no interest in these other drugs, because on a cost basis, they're very inexpensive, and have been shown to be effective. Well, we've been visiting today with Dr. Nathan Goodyear, who's the medical director at Brio-Medical Center here in Scottsdale. For any of you that want to know more information, go to Brio-Medical.com or go to drgoodyear.com podcasts. He's got some great material, and this would be great for you. And I would highly encourage you, if you've been diagnosed with cancer, I highly recommend that you take a look at Brio-Medical Center. That's where I brought my wife, and that's where I would go bring any of my family members. So thank you again, Dr. Goodyear, for joining us, and congratulations on your wonderful work. And may God bless you and all you do and all your patients. I hope they have tremendous health and recovery from your help. Thank you, sir.
Thank you, Dr. Hotze.
God bless you now. And thank each one of you for joining us today. I'm Dr. Steve Hotze. We'll see you next Monday. Bye now.